una lunghezza di 8 ore e 40 minuti, se me lo dicevano prima che accadesse non ci avrei creduto, perché dico è troppo tempo.
With Braun's motto, built for life, they mean it. Because if you're the first one getting an ambulance there, if you're the last one getting an ambulance, or you're buying some parts, you want to make it a lifetime partnership. It's got to be about the end game. It can't be about a sole purchase. It can't be about something, we're not going to give you the kind of attention because you're not going to buy enough rigs from us. No, it's everyone, every single time. You matter. I know it because we don't buy but one ambulance every 2 years, and I always have felt as though Fond du Lac matters to Braun and to our dealer, and that's something special. I mean, you don't see that everywhere. We hope they're built forever. We hope these rigs that we have stand up to the rigorous paces we put them through, and we put them through it.
On behalf of Medline, we want to celebrate and acknowledge the entirety of the EMS family. The job of an EMS professional is never predictable, but even those who are best suited for healthcare's biggest surprises had no clue how a global pandemic could turn our world upside down. No part of the last year has been easy, except Medline's decision and desire to stand by your side and equip you with what you need to conquer each day. From being transparent with you to being there for you, Medline was glad to have your back. Your dedication to stepping up during a challenging time deserves all the recognition. So today and always, let Medline be the first to express our heartfelt thanks. No matter what we may face next, we are in this together.
All right, I have 11 o'clock. We'll go ahead and get started. First of all, everybody, welcome to the EMS Day on the Hill briefing. It's my great pleasure to welcome you here. Thank you so much for making this special effort to be here to represent the EMS profession. Since 2010, EMS Day on the Hill has been a very visible display of our professional unity on behalf of our communities and the patients. I'm very pleased to report this year that we have 291 registrants from 50 states, including the District of Columbia, Puerto Rico, a new record for EMS Day on the Hill. Through our years of advocacy work, we have clearly learned that the most productive way to advance EMS and enhance our ability to serve our patients and our communities is through a unified message to our legislative leaders. In 2020, EMS Day on the Hill was scheduled for March 25th. However, the rapid spread of COVID-19 led to the NEMT Board of Directors to make a difficult decision on March 12th to cancel Hill Day last year. The pandemic was declared a federal public health emergency on March 13th. Since then, our EMS workforce has served as warriors on the front line of the pandemic. We have all lived through the challenges, the exhaustion, and the heartbreak that this pandemic has caused. But the EMS profession stood tall throughout the crisis. We continued to serve our patients in our communities, and we demonstrated our ability to adapt and respond to a rapidly changing environment. In addition to providing our traditional 911 response, we also provided COVID testing, vaccinations, monoclonal antibodies to patients. Many of our workforce have been filling in at hospitals or substituting as school nurses. Our national organizations also rapidly adapted as well to address the immediate needs of our members. In 2020, leaders from the National Association of EMTs, the American Ambulance Association, and the International Association of Fire Chiefs and the International Association of Firefighters began meeting on a regular basis to discuss critical challenges for our workforce and the agencies that were encountering and developing joint strategies to advocate on their behalf. Together, we have advocated to the administration and to Congress to address the lack of PPE, to ensure that EMS had priority access to testing and vaccinations, obtaining federal financial relief for agencies faced with huge cost overruns compounded by lower call volumes, and to obtain reimbursement for treatment in place during the public health emergency. We also worked together to collect information on COVID-19 exposures, illnesses, and deaths within our workforce, and the impact of COVID on our agency's abilities to operate. That information we collected was used to support our federal advocacy efforts. As we come together this year at this year's EMS Day on the Hill, we thank our colleagues at the AAA, the IFC, the IFF, as well as the National Volunteer Fire Council and the National Association of State EMS Officials for their tremendous collaboration. We also thank each and every one of you, our EMS Day on the Hill attendees, for taking the time to represent your colleagues, your agency, and your state. We greatly appreciate your willingness to advocate on behalf of our profession and our industry. EMS Day on the Hill is an essential component of a wider advocacy strategy that our industry carries out. National associations, state associations, EMS agencies, and individuals contribute time, energy, and financial resources to advance the EMS agenda. Financial resources are an essential component to an effective advocacy campaign. Through our Political Action Committee, or a PAC, to which members of associations can contribute, EMS can support candidates who support our profession and our industry. PACs are a reality of the American political landscape, and EMS needs to use this tool in order to fully engage in political advocacy. NEMT established the NEMT EMS PAC in 2018 to help us support candidates who are friends of the EMS profession and the patients we serve. In addition, NEMT's PAC, the AAA, the Congressional Fire Service Institute, and the National Association of EMS Physicians all have PACs to help elect EMS-friendly legislators. We encourage all of you to contribute to your association's PAC and bolster the advocacy efforts on behalf of EMS. As you all know, funding is probably the single greatest challenge facing EMS. And funding EMS Day on the Hill is a yearly challenge as well. NEMT works hard to keep the registration fee very low because we recognize the investment you make to participate. NEMT seeks assistance from EMS supporters to help offset the cost of holding this event. We are deeply grateful to the companies that have sponsored this year's Hill Day. And it is these organizations that have helped make EMS Day, the EMS on the Hill Day, possible. So I'd like to recognize our pillar sponsor, Stryker, our briefing sponsor, the American College of Emergency Physicians, Braun Industries, Medline Industries, and Zoll Medical. Our advocate sponsors, the Coalition Against Big Trucks and General Devices. And our friends of the EMS Day on the Hill, Page, Wolfberg, and Worth. Thank you to all of our generous sponsors. Now, many of us in EMS have been involved in EMS payment reform for the past several years. Today, you'll receive an update on 2 federal reimbursement initiatives. First, it is my pleasure to introduce Tim Dienst, the CEO from UPass Regional Health Services District in Colorado, who will provide you an update on the ET3 project. Tim, take it away.
Good morning, ladies and gentlemen. Welcome to the ET3 update. And I guess for those of you on the East Coast, it's good afternoon. And for everybody west of Colorado, it's still good morning. Emergency triage, treat, and transport model designed to provide greater flexibility for ambulance care was envisioned to, 1, provide ambulance transport opportunities to alternate destinations. 2, initiate and facilitate treatment in place tip with qualified health partners either at the scene of an emergency response or via telehealth. And 3, to encourage other payers such as state Medicaid plans and other commercial payers to establish payment benefits for these types of services. Selected agencies were supposed to initiate these programs last year. However, CMS delayed the implementation of these programs because of COVID-19 and the public health emergency. You see, CMS realized that they, along with the selected participants, would struggle to implement the many program requirements while at the same time react to the many challenges posed to them by the pandemic. However, the first performance period did begin January 1st of this year. So the program is now active. Also in March of this year, CMS issued a notice of funding opportunity of up to $34 million over a 2-year period for local and state governments to expand emergency and non-emergency triage services in locations where ET3 model participants are located. These public safety answering points can now apply for up to about $1.1 million specifically to triage 911 callers to the most appropriate level of services. At the same time, and even when you think of everything that happened throughout last year, there were a few other notable things that occurred. While flexing to the COVID crisis itself, CMS still continued to provide an unprecedented level of support to the ET3 participants. 2, they expanded the list of allowable destinations for all ambulance services, similar to those to the ET3 participant lists. However, it's notable that during the public health emergency, this expanded list continues to be active. However, at the end of the public health emergency, those destinations will still be limited to the ET3 participants. 3, multiple agencies around the country, large and small, private and public, fire and other based services, started to implement treatment in place services to include telehealth and treatment in place. They did so with remarkable success. And probably 4th, the most significant benefit that occurred out of this was Our major players, our partners, to include the NAEMT, the American Ambulance Association, the IAFF, and the International Association of Fire Chiefs, all work together to find common ground to corral legislators, write legislation, and pass TIP, treatment in lieu of transport. That's TIP, actually, treatment in lieu of transport, so that we can receive payments for treatment in lieu of transportation services. We hope, in working with our partners, that this will include treatment in place type services going back all the way to the beginning of the public health emergency. That just goes to show what working together really can accomplish when we set our minds and our hearts to improve patient care in our communities and to the patients that we serve. For more information on the treatment, emergency triage, treat, and transport, you can visit our website, or you can go to innovation.cms.gov, innovation models /ET3. Thank you very much for this opportunity to give you an update on the ET3 program.
Thanks, Tim. So now I'll move on to Matt Zavatsky, NAMT's immediate past president and chair of our EMS Economics Committee, and he will provide you an update on the CMS cost collection effort. Take it away, Matt.
Thanks, Bruce, and it's nice to be virtually with everyone. We hope that we can be in person together next year. So hope springs eternal. As some of you may know, effective January 1st of 2020 and continuing through 2024, ground ambulance providers and suppliers have been selected to participate in the Medicare Ground Ambulance Data Collection System. That's a mouthful. We often refer to it as the Ambulance Cost Data Collection, or ACDC. So for those of you that are my age, you'll get a kick out of that. We'll just use that terminology. This program was supposed to start last January. But because, again, the public health emergency has changed pretty much everything, CMS issued a blanket waiver in May of 2020, delaying the data collection and reporting for those ground ambulance organizations that were selected to report in year one. CMS and we were concerned that the COVID pandemic would further strain the capacity of ground ambulance organizations in 2021. CMS delayed the data collection and reporting period for ground ambulances for 2 years, and for those that were reporting in year one, and 1 year for the ambulance services that were to report in year two. With this modification, the data collection period for year one and year two will begin between January 1st, 2022, so next January, and December 31st, 2022. What's interesting is that they're anticipating not collecting data during calendar year 2020, because for many of us, the cost and revenue data is all jacked up. So we'll see how that works out. The American Ambulance Association and several other entities have developed tools to help educate agencies on how to do this, because it's really important that we are accurate in reporting our costs and our revenues so that CMS can determine whether or not the current rates that we are being reimbursed are fair and equitable. Thank you very much. Now, we heard from a lot of smaller EMS agencies and ambulance providers and suppliers that this was a daunting task for a lot of them. So the NAEMT EMS Economics Committee put a group together to literally come up with a guide for small EMS agencies on how to prepare for and complete the CMS cost data collection process. This guide is now available. It was sent out by NAEMT and is available for download on our website under the Publications tab, and is free for anybody who wants to use it. It actually walks you through each point that CMS wants to collect, each data point, and then gives some advice on where that information can be found, and some pearls about what to report, what not to report, some things to take into account when you are developing the data that your agency is going to be submitting to CMS. Again, this is all in an effort by NAEMT to help make sure that agencies that might not be used to doing a lot of financial and data and revenue reporting have the tools in advance to prepare for and then submit their cost data collection to see if we can change the reimbursement levels from CMS to be more accurate with the true cost of delivering service. And I just want to thank several of the team members who really helped put that together. Chris Hansen, Steve Kroll, Adam Parker, Matt Sorrentino, and Deborah Von Segern Johnson. They did an amazing job. Even if you're not going to be doing the cost reporting yourself, download it. That'll give you some great insight into our industry and how these things are going to be reported. Thank you very much. And Bruce, back to you, sir.
Thank you, Matt. As you can see, our EMS Economics Committee has been doing a lot of hard work, and this is a meat and potatoes issue that's really important to our organizations. As you can see, again, our industry leaders are working tirelessly to improve on the economic model for EMS to bring about higher value to our stakeholders and hopefully facilitate the ability for EMTs and paramedics to be paid based on the value they bring to the healthcare system. We'll now review 4 of our Hill Day requests to Congress. After each of the requests have been presented, there will be a Q&A session afterwards. So please hold your questions till the end of the presentations by the 4 presenters. I'm going to start out first by introducing, and it's my pleasure to have invited Sean Baird, the president of the American Ambulance Association, to provide an overview of our first request to Congress. Sean?
Good morning, everyone. Thank you for inviting me to be a part of this very, very important day that everyone will be participating on the Hill. As a 30-year plus paramedic myself, I am going to be confident in taking a wild guess that absolutely no one on the call this morning got into this field because they wanted to learn everything they could about Medicare and CMS. But I have a very fine thing to offer you all, which is the 5-minute MBA program in EMS finance. And what I'm going to cover is the first of our legislative asks during EMS on the Hill Day, and it's our Medicare relief legislation. And if you will jot down the initials MBA that you can put behind your name when we're done here, I can make it pretty straightforward for you. Medicare is the big payer for all of us in EMS, regardless of what service type you work in. I'm quite confident that we all, as EMTs and paramedics, primarily take care of older folks. Those are the folks who have emergencies. Those are the folks who are fragile. Those are the folks that you can tell stories to your legislator about the work you do and have it be meaningful, because we all have parents and grandparents and aunts and uncles, some of whom are in frail condition, and we can all relate to it. And legislative offices love to hear about the work you do taking care of our older community. So your MBA, here it is. M, most of our patients are on Medicare. Most Medicare. B, below cost reimbursement for those patients is a tremendous problem for the industry. This has been studied by Congress, by outsiders. Everybody agrees below cost reimbursement from Medicare is a real problem for us. A, add-ons to the Medicare payment are what's saving the day for EMS. MBA. When you talk about this bill, if you can remember those 3 points, that most of our patients are on Medicare, that below cost reimbursement is really a tremendous burden for us as providers, and that A, the add-ons are essential, I think that's all you need to know. All the rest of the details are in there. We have a bill that's going to be introduced hopefully as soon as April 8th, but it may be the following week due to the Easter recess. Introduced by Congresswoman Sewell, Congressman Blumenauer, Congressman Welch, and Upton and Mullen. And you'll get a briefing paper with all of this. Those folks have taken this on to be champions of it in the House. And we have a name for you to ask if your member or their staff is interested in helping us with our Medicare issue. They're going to want to contact Earl Flood in Congresswoman Sewell's office to sign on as a co-sponsor. On the Senate side, we are progressing with a number of different offices that would like to potentially champion this. We're probably about 2 weeks out from getting a bill introduced, and we will provide follow-up if any of your meetings lead to staffers being interested or members of Congress being interested. Just let them know that we will follow up with their office with the information on who the lead sponsors are going to be, or if they are interested in being an original sponsor themselves, to let us know. So that's really the big ask of the Medicare legislation, and it's to continue something that's been going on for quite a few years. Thank you.
Sean, as a super rural provider, I'm grateful for those Medicare extenders, and I thank you for your overview, and a big thanks to the AAA for leading the effort to get this bill introduced. Now it's my pleasure to welcome Chief Gary Ludwig, the past president of the International Association of Fire Chiefs, to provide an overview of the 2022 Siren Grant appropriations. Chief Ludwig.
Thanks, Bruce. It's good seeing you all today, and it's good and it's an honor to be on here today with all of you. So first, let me say thanks to all of you for what you do every day in your communities. Second, thank you for being our champions and our advocates for EMS Day on the Hill. I am confident that you will all make a difference. So I'm going to talk to you about the Siren Act, and Siren stands for, it's an acronym that stands for Supporting and Improving Rural EMS Needs. The Siren Act is relatively new. It's a program to assist only rural EMS agencies. It's not for urban or suburban EMS departments. And I think we all can agree that everyone is facing budget challenges. It doesn't matter if you're urban, suburban, or rural, but the rural community has been especially hard hit. And typically, they got to balance their budgets based upon bingo games and barbecues and other types of fundraisers. But that hasn't been enough during these COVID times. Fundraising has even been harder as the stay-at-home rules have basically made all those challenges even more difficult. They basically have eliminated any type of communal types of gatherings at all. And so you just can't fundraise as you typically have. I think we also can agree, based on what we had just heard, is that Medicare and Medicaid, they don't pay enough. They don't cover our costs for what we do. I don't know of any EMS agency that gets enough reimbursement from Medicare or Medicaid, especially Medicaid, but we want to talk about Medicare today, that covers their costs just for the cost of one particular call. So this has been challenging for not only for transport agencies, but also for non-transport agencies. So this Siren Act grant can be used for a variety of different types of projects. It's not limited. It can be used for medications such as purchasing Narcan. You can use it to recruit volunteer personnel. You can also use it to buy ambulances. You can use it for training classes. And the way the program works is each grant award is capped at $200,000. And the reason why is because we only have $5 million currently within the initial, and now it's up to 5.5 million. So if you were to give one agency half of that, 200 or 2.5 million, that would eat up the grant. So the awards are capped at $200,000. And what's unique about them and what's beautiful about it is that money comes directly to your rural EMS agency from the federal government. There's no pass-through agency. There is no state agency, no Department of Public Health that's going to take the 10, 15, 20% administrative cost off the top of that, and you get less money out of that $200,000. That $200,000 goes directly to your agency straight from the federal government. So one of the things that's important is that you have to qualify as an agency that is in a rural area. You have to have a valid EMS license, and you have to be a governmental or nonprofit EMS agency. And even non-transport BLS agencies are eligible. career and volunteer agencies are eligible. And I guess the easiest way is if you're a transport agency, if your agency meets the rural definition, is to see whether or not you receive the rural or super rural add-on payments when Medicare reimburses your agency for transport services. So the Siren Grant is administered through a federal agency called the Substance Abuse and Mental Health Services Administration. And as I said, this is relatively new. It was created in 2018. And again, in 2018, that program was only funded, and I say only, at $5 million. That was in FY 2020. That money was used to award 27 different agencies grants that year that included fire departments, rescue squads, and third service EMS agencies. Most of those awards were used for training, and even some agencies elevated their services from BLS to ALS, and also for recruiting new volunteers. The unfortunate side of that is 39 agencies that actually filed applications did not receive anything because the funding was just not there. It was rejected because the funding wasn't available. So the Substance Abuse and Mental Health Services Administration, again, that's the agency that funds this and administrates this program. I'm sorry, they don't fund it, they administrate it, believes they would need another $8 million. They would have needed another $8 million to fund all those applications of those that got rejected. Now, this last budget year, we saw an increase of only $500,000. So the current funding for this is $5.5 million for the Siren Act grant. And the application period just closed here on March 18th. And that $500,000 will help, but there was a total of 76 agencies that applied for that. It's up from where it was previously. So again, there will be, unfortunately, some agencies that will not receive the grants because they'll be rejected because there's just not enough funding. So here's where you can help. We're asking Congress to provide $20 million for the Siren Act grants in FY 2022. This additional funding will allow the agency that administrates these grants to make a total of 100 awards. We believe this is the appropriate amount given the significant amount that previously existed and the fact that COVID has only made that need worse. So one of the most important things that you can do is educate congressional staffers when you speak with them on the realities of the tough budget environments facing fire and EMS agencies. And if your agency does fundraising through bingo games, barbecues, fish fries, or any other similar events, if you are one of those people, if you come from one of these agencies, please personalize it and talk to the members of Congress and their staff about how much harder it is fundraising during these times with COVID. Please consider, as I said, sharing stories of your agency that has had increasingly hard times fundraising for training, recruitment, and also buying supplies. Make sure you personalize it, the information that you're sharing, so that the congressional offices, and when they hear the story, when they see the act and the funding comes up, that they know that it's impacting their district and they can relate back to your stories. You want the staffers to think of Siren and EMS funding, and then you want them to make sure, remember that this is an important connection back to their communities and to you. And with that said, again, Bruce, thank you for the opportunity. And to those that are listening online today, thank you. And I wish you much success as you speak to our representatives up on the Hill.
As a agency that has an application in for Siren, I thank you, Gary, for your overview on this important topic and for the IFC's continuous work on this critical grant program. And now Greg Russell, the Government Relations Manager at the International Association of Firefighters, will provide an overview on the EMS Counts Act. Greg?
Good afternoon, everyone. My name is Greg Russell, and I'm with the International Association of Firefighters. I'm here today to speak to you about the importance of the EMS Counts Act. I apologize. Again, my name is Greg Russell, and I'm here to ask everyone to support the EMS Counts Act. The EMS Counts Act was just introduced this past week. It is HR 2354. Again, it's HR 2354. So what is the HR 2354 EMS Counts Act? Well, in simple terms, it directs the Secretary of Labor to adjust how they report out the number of EMS providers within the Bureau of Labor Statistics Standard Occupational Classification System. Currently, they lump all EMS providers under one simple heading of EMS providers, EMTs, and that misses all of those that are self-identified as a firefighter first. So under EMS Counts Act, the Bureau of Labor Statistics would report out, would change the standard occupational classification system to report out basically 4 new occupations. They would report out a firefighter EMT, a firefighter paramedic, and firefighters all other. This change will address the chronic miscounting of EMS providers by allowing firefighters to identify themselves first as firefighters, but also as cross-trained EMS providers. By way of background, emergency medical services is an integral component of our nation's response capabilities to man-made and natural disasters, to the sick, the injured, to the global pandemic, to the shootings that we all respond to on an all too frequent basis, to other accidents in the home and in business. It's important that our EMS practitioners are all counted, and this includes paramedics, emergency medical technicians, our dual role firefighter EMTs, and our dual role firefighter paramedics. These professionals respond to 29 million 911 calls a year. Without correct data of EMTs and paramedics practicing throughout the United States, it is really difficult to plan and meet the health and safety demands of the community and the EMS providers. The Bureau of Labor Statistics collect this data and release it monthly. When they collect this data, they identify the jobs created and job loss. Unfortunately, the Department of Labor's current occupational classification system does not accurately identify firefighters who are cross-trained as paramedics or EMTs. Given the fact that 62% of all 911 calls are handled by fire departments who provide EMS services, the failure to recognize cross-trained dual role providers places the data at a significant and chronic undercount status as far as EMS personnel are concerned. The Bureau of Labor Statistics has not implemented a change that was brought to them by a group of 17 stakeholder groups asking for them to consider that, or asking them to make a change in the collection system so it would accurately identify cross-trained dual role providers. Heeding this recommendation, the U.S. would have been able to better track the gaps in emergency medical services to meet the needs of the community. This includes planning for our daily needs and planning staffing for major disasters and public health emergencies. Let me give you a couple of examples. First, we all know that collection of funds from government entities depends highly on data. When you're advocating for more money in order to staff or create more EMS jobs, you'll need to be able to demonstrate what the current status, what the current numbers of providers are in your communities. Without accurate data, you will always have a chronic underreport. This could impact you as far as ability to staff new and emerging response units teams, or to be a part of pilot programs where funding or personnel is available. Another example that we have all just lived through is the response to COVID. Last fall, the National Academy of Medicine looked at EMS groups to determine the proper number of vaccines to be provided for emergency medical services responders. Based on the numbers that they allocated for, they only identified 248,000 paramedics and EMTs, when in reality, in this nation, there's currently approximately 1 million providers out there. So this is a flawed number, and we need to get that corrected. So there will be proper allocations of supplies and equipment necessary for EMS providers to carry out their job. So it's time for Congress to act on the EMS Counts Act to take the steps necessary to ensure incorrect data does not harm other areas of policymaking and funding. So as you visit the Hill, we're going to ask that you contact members and ask them to co-sponsor HR 2354. Again, HR 2354, the EMS Counts Act of 2021. And for specific information, I want to direct you to Julia and Representative Susan Wild's office, or Kevin and Representative Fred Keller's office. Again, thank you for being out there advocating on behalf of EMS. And we really do appreciate any help you can give us generating co-sponsors for the EMS Counts Act. Thank you. Bruce?
Thank you, Greg, for your overview, and to the whole team at the IAFF who have helped work with us on EMS counts and several other bills this year. Now, Matt Zavaskiel will provide us with an overview of our last request and a thank you to Congress on treatment in place. Matt.
Thank you again, Bruce. And yeah, we are very excited. You know, as many of you may know, Congress passed the American Rescue Plan Act, or ARPA, because we love our acronym, so ARPA. And there's a specific section in ARPA that provides HHS, the parent organization for CMS, the authority to issue an emergency waiver allowing ambulance services to be reimbursed for treatment in place that was done as part of a community-wide protocol. Now, you'll notice that we were very specific there and with intent. When the American Ambulance Association, the International Association of Fire Chiefs, the IAFF, a number of other organizations, and NAEMT were working very, very hard during the pandemic to find ways for EMS to be reimbursed for treatment in place, part of that discussion with the legislators who were willing to sponsor the legislation and with CMS was initially a very narrow definition of what would be eligible for reimbursement if you did not transport someone to the hospital. In your discussions with members of Congress and their staff during EMS on the Hill Day, you need to be a little bit specific that this waiver authority means that CMS can issue the waiver. We'll talk more about that in just a second, but it's only temporary. It's only during the public health emergency, and it is different than what you heard Tim talk about under the treatment in place language for ET3. During a recent webinar, Brian Werfel from Werfel and Associates used the term TILT. So we're going to mention that TILT, meaning treatment in lieu of transport. And what that means is, but for a protocol in your community, there was a protocol in your community that told you or instructed you or encouraged you to not transport someone to the hospital. That's what this language does. It allows ambulance services to be reimbursed for TILT, treatment in lieu of transport, during the public health emergency. Now, we're also hopeful that, like with the other emergency waivers that CMS has issued, this will be effective retrospectively to the start of the public health emergency, or on or about March 1st of 2020. That will help a lot from a reimbursement perspective and a funding perspective for a lot of agencies who are doing the right thing, triaging patients, referring them to appropriate levels of care, but not transporting them, and therefore we're not able to get reimbursed. I will say that, as you've heard all throughout the briefing so far, this alliance, this quad alliance between NAEMT, the AAA, IAFF, and IFC really work together to get this legislation pushed forward. And even more so, we are now collaboratively working with CMS to help them craft the waiver language to make it as broad as possible, so that as many agencies can take advantage of this particular waiver as incredibly possible. But again, it only is for the public health emergency, and it only covers a very narrow number of patients. So what we are now going to do is start discussing with Congress, making this waiver permanent. Now, you'll notice that with a lot of the waivers that CMS has issued during the public health emergency, MedPAC and CMS and others have said some of those waivers are good public policy. And even though they were implemented during a public health emergency, they probably should become the norm moving forward. We think this is one of those waivers. So starting now, we are going to start requesting Congress to make that waiver permanent so that payment for treatment in lieu of transport, or some now might say if it becomes permanent, treatment in place, really makes more sense for the patient, makes more sense for the agency, and certainly makes more sense for the payer, in this case, Medicare. So you've got the talking points, or you'll have them shortly if they come through your spam filter, or you'll certainly get them before your meetings with members of Congress. But ask them, hey, thank them very much for passing the ARPA that included payment for EMS non-transport or transport in lieu of treatment. But let's kind of take it to the next level and see if we can make that permanent, because it's just good public policy. Just in closing, I want to mention that when you're talking with your members of Congress, CMS has been so incredibly cooperative, collaborative, and engaging with the EMS industry. I know for many of us, Gary and Bruce and Aaron and Sean and the folks all across the board from all the associations, certainly Jeff, have worked with CMS or been in this industry for a long time, and never in the history of that million years of experience have we seen Medicare and CMS be so responsive to some of the needs that we're having. So if you get a chance with your members of Congress, mention the fact that CMS has been terrific to work with. They've been very helpful. And now let's help them go to the next level and make this public policy permanent, because it's good for everybody. With that, Bruce, back to you, sir.
All right. Thank you, Matt, for this overview and for your strong leadership on TIP. And, that I have to echo those sentiments exactly. I think we're on the beach at CMMS, and we just need to advance that beachhead a little bit further. They're finally understanding a little bit more about what we do, and they're listening. Now we'll take some questions about the request from our attendees. Chelsea Hickman from our partners at Winning Strategies Washington will assist me with these questions. So Chelsea, first question.
Thanks, Bruce. The first question was about EMS personnel. This was about the EMS Counts Act. The question is, what about part-time EMS personnel who are paid or who are on call? How are they going to be counted? Because they are also not included in the U.S. Bureau of Labor Statistics. So, Greg, do you want to take a stab at that? Or
Sure. So under the Bureau of Labor Statistics, they will count you by your primary occupation. If you are identified as a primary occupation of a dentist, but you're a part-time on-call medic, you'll be reported to the Bureau of Labor Statistics as a dentist. Likewise, if you're a firefighter, but you work part-time on call, you would be identified as a firefighter.
thank you. And we had another question about that. If you are a paramedic only, you would select EMT. That's correct.
That's correct.
Great, thank you.
And Chelsea, I think
Please,
it's important to note, we looked at the delineations of EMT, EMT intermediate, EMT, the old EMTP and we lumped all those into that same category. So I know that EMT intermediate is also, or advanced EMT is also missing, but those are to be lumped in with the regular EMT position.
Thank you. We had a question about the Senate version of HR 2354, which of course is EMS counts. We are working on a Senate version, and so we hope to have that information soon, but it's important for you all when you're doing your meetings to make sure that senators know that you support it, and that gives us a chance to get more support when we get it introduced. We have a question about EMS treatment in place. Would the reimbursement for EMS treatment in place also apply to non-transport agencies or only to transport agencies?
That is a terrific question. And on the federal level, currently, only licensed or enrolled providers or suppliers would be eligible for treatment in place. And today, ambulance services, ambulance suppliers or providers are the enrolled Medicare providers. First response agencies are not considered suppliers or providers and are typically not enrolled in the Medicare program. But there may be opportunities with other payers in your local community. Medicaid has a little bit of some different guidelines, but from the Medicare perspective, it would require, again, probably change in legislation that would allow a non-transport entity to become a provider under the Medicare statute. And knowing how hard it was just to get this slight thing changed, that would be a very, very heavy lift. So the short answer is no, currently non-transport agencies, if you're not a Medicare enrolled provider or supplier, would not be eligible for TILT or TIP.
One more question, Matt, while we're on that. Another question was what's considered treatment that could be reimbursed? So is it treating a diabetic with some dextrose and then taking a refusal? Is it evaluating a COVID patient and then taking them home without transport? What counts as treatment that could be reimbursed?
Pretty much everything. So if you respond, arrive on scene and make a patient contact, meaning that you had a patient they actually assessed. And by the way, it's important to note that patient has Medicare because this would apply to Medicare patients. Although a thought just came to mind, we should try and make sure that the uninsured fund covers for the uninsured patients like they've done with some of these other waivers for vaccines and monoclonal antibodies. We'll have that conversation offline. So as long as there's a patient there, you've made patient contact, it doesn't matter what level of treatment. If you've done advanced care by your protocols, then that would probably be eligible for an advanced ALS emergency reimbursement. If it was basic life support only that you provided on scene, it would probably be reimbursed at the basic level of care reimbursement, much like TIP under ET3. And there's already a model for that. There's already codes for that. So we would probably mirror that program. But again, as long as there's a patient, and if you didn't transport, then you'd be eligible for the treatment in lieu of transport or TILT.
Thanks,
So,
Matt.
Matt,
A couple other questions and then we can move on.
Yeah, Matt, I just wanted to follow up on the question on the non-transport agencies. So say, for example, an agency like LA County Fire, where it's first response squads and that are ALS, and then potentially either BLS or ALS ambulance transport under contract. Would potentially both of those agencies be available to get TIP or TILT, or is it just the transporting licensed transport provider in that area?
Great question, Bruce. And it is likely, probable, almost definite, that the ambulance service that arrives on the scene will be the one to be eligible for submitting the claim and getting reimbursed for the TILT. Again, they will follow their statutory guidance. The only change in the statutory guidance is if the ambulance arrives and doesn't transport, they could be eligible for reimbursement. And it's only going to be one provider. And a lot of us went through this with the ET3 program. And CMS has been pretty clear that an ambulance has to be on scene, and that ambulance provider is the one who would bill and get reimbursed. In the case of LA County, even if they're the ambulance provider, but they only send a first response unit, if it's not a transport capable ambulance that doesn't arrive on, if a transport capable ambulance does not arrive on scene, they would not be eligible to bill for the treatment in place. It has to be an ambulance on scene.
Thanks, Matt. There are several questions about the EMS counts. What counts as a paramedic? What if you're a volunteer? We're going to post more information on NAEMT's website answering all of those questions. I want to get to just a couple more on before we move forward. There was a question on Siren, and are tribal entities eligible to apply for Siren?
So
Yeah.
I think that might require a bit of little bit of research, but I typically legislation and that comes out of the Congress does not exclude tribal EMS agencies. So I would lean towards that tribal EMS agencies are available if they qualify as a rural EMS agency also.
Yeah, and Gary, I can follow up on that a little bit. Having not made the hurdle on last year's Siren grant, and looking at the recipients that did get Siren last year, there were a couple of tribes in there. So it seems apparent that the tribal organizations, tribal EMS, is definitely a significant player and an awardee in last year's Siren grant.
Wonderful. Thanks for adding on to that, Bruce. I appreciate that.
There's one more question about Siren. Rural agencies that don't have a CON, a non-transport to hospital, are they eligible for Siren grants?
Yes, if you don't transport, but you're a rural EMS agency, you can apply, yes.
Great, thank you. I think there are, as I said, there are several questions about EMS counts. We will answer all of those on NAEMT's website to make sure that everybody has the information that they need. But I think, Bruce, we're ready to move to the next part of the program.
Okay. So now we're going to turn to the logistics of this year's Hill Day visits. And as all our meetings are going to be virtual this year, Chelsea will review all of the logistics for our meetings. Take it away, Chelsea.
Thanks, Bruce. So to say that this year is different is an understatement. Whether you're participating in your first EMS on the Hill Day or your 10th, I just want you to know how grateful we are for your participation. I know everybody has a full-time job and this is not part of the description, but I just want you to know that this is so important and it is so critical for lawmakers and their staff to hear from you, and it really does make a difference. You can be just as effective with virtual advocacy as you can with doing it in person. So just to make sure everybody's on the same page, there are a couple of things going on. One is every state will have a state briefing. Those are happening this afternoon, tomorrow, and the next day. And you should have received an invitation. If you did not, you can shoot an email to emsonthehill@wswdc.com. Make sure you check your spam filter, but the schedule is posted here. So this is an opportunity for all the attendees from your state to get on the same page, to meet together, to coordinate. A meeting facilitator has been identified for every state. And so that meeting facilitator will walk you through Zoom do's and don'ts, what to expect from the Hill meetings and other questions like that. Our meeting targets included both senators from each state and then the representatives from every district where we had an attendee. So most of you will have just 3 meetings, and that will be with your senior senator, with your junior senator or their staff, and with the representative where you live or work. While our event spans Monday through Friday of next week, each state will only have meetings on one day. So in other words, each state has been assigned a meeting date, and all of the meetings that you'll have will occur on that date. If you have any questions about what you're supposed to be doing, where you're supposed to be, just send us an email at emsonthehill@wswdc.com. So you can see here, this is the schedule. The meeting invitations have started going out. You'll get them via email, and it'll be a calendar invitation. You'll have the Zoom link as well as the links to the request to Congress. If you don't get those, by all means, let us know, and we'll make sure to take care of that for you. So if the calendar invitation says member meeting, just note that means the senator or the representative is supposed to attend the meeting himself or herself. Otherwise, you'll be meeting with staff, and their name and title will be listed on the calendar. The dress code is business or dress uniform. And just know that some of the staff you're meeting with might be dressed a little bit more casually because some of them are working from home or other circumstances. On Friday, you should have received an email from NAEMT that has do's and don'ts, the talking points, the other materials we've talked about. I put a link in the chat. In case you didn't get that email, there's a link in the chat where you can access all of that information. I want to ask you to review all that carefully. And if you have questions, by all means, let us know. But I want to just go over a few do's and don'ts just to make sure that everybody is as prepared as they possibly can be. And some of these might seem obvious, but they're on the list because we've seen problems with them in the past. So before the meeting, do make sure that you've got the Zoom link, that you've tested it, that if there's anything you have to download on your computer, that it's ready to go. And make sure your device has a camera, that it's uncovered, that it's working, that everything's in working order. Make sure you're in a quiet place with a neutral background, that there's not dirty dishes or something in the background. And make sure you know who is taking the lead. Make sure you have the agenda, which is what you'll do during your state briefings this week. Make sure you know what your role is. And if you can, join a few minutes early so that the meeting can start on time. During the meeting, as Gary said, it's so important for everybody, for these members of Congress to understand what you do and how it contributes to the community. So talk about that. Talk about what you're doing, how it affects their constituents, and how the requests that you're making will affect their constituents. During the meeting, turn on your camera. Leave it on the whole time, and if you possibly can, because that's how you show you are engaged, and it will make for better meeting. You'll find that some staff won't join by video, and that's just because they may be working from home or something like that, but that's the best way for you to show you're engaged. The other do is stick with the script. As you've heard from our presenters today, we have a unified voice, and these priorities were chosen deliberately to help the EMS profession as much as possible. And so we will make the biggest impact if we stick to the script and make sure that we're all speaking with a unified voice. A couple of don'ts. Don't be disappointed if you end up meeting with staff and not the member of Congress. The staff is really important. They have the members' ear, and they're the ones who will make things happen, whether it's co-sponsoring legislation or following up on something. So don't be disappointed if it's a staff member. Also, don't assume that they know anything about the legislation that we're talking about. Some staff will, but others won't. So it's fine to start the conversation with something like, so how much do you know about the EMS Counts Act? And then they can give you a baseline. Maybe they don't know anything and you can start from scratch. The other don't that I want to emphasize is don't talk about politics. There is a very firm divide between what the members, congressional staff do, who you'll be meeting with, and the political campaign, fundraising side. And so if you talk about, oh, I supported, Congressman Smith in his last reelection, or I attended a fundraiser or something like that, it turns the staff off, and it puts them in a really uncomfortable situation and makes them less likely to be receptive to our requests. So just be mindful of that. Just a couple of other important things to note. If you are presenting one of the requests to Congress and you're running late for a meeting, let the meeting facilitator know as soon as possible so that they can accommodate. If you're going to be, just a minute or two late, then join as soon as you can. But if you know that you're going to miss your opportunity, let the meeting facilitator know. And likewise, if you're going to miss any of your meetings, please let us know. In some cases, you might be the only constituent in that meeting. And so it is really critically important that you attend all of the meetings that we've scheduled for you, or you let us know that you're not able to do so. As I said before, joining with video is ideal, but if for some reason the video doesn't work, if you are in a place that doesn't have reliable broadband, if there's some other reason that you can't do it, each invitation that you get for your calendar through your email will include a call-in option. So you can, if for some reason the link doesn't work, if for some reason you can't join using video, there is a dial-in option for every meeting. So just know that that's a backup. And with that, I'd be happy to answer any questions you might have. I'll take a look and see if folks have questions. So one of the questions was, if you're unable to make one of the meetings, who should we contact? Great question. Send an email to EMS on the Hill Day. Actually, send an email to advocacy@naemt.org, and we will coordinate together to make sure that we get that taken care of. Do others have questions? Any other questions about the materials? We'll update everything that's on the NAEMT website after this event to make sure that everything's current. If you have any other questions about which state you're assigned to, where your meetings are, the best way to do that is contact us by email, emsonthehill@wswdc.com. The other question was, will the staffers get the handouts prior to the Zoom call? Yes, there will be a link to the handouts the request to Congress in the email that the staffers get with the Zoom link. So if they ask you, oh, I didn't get the materials, where are the materials? You can tell them it's in the calendar invitation that they received. There are links to them. Great. Bruce, with that, I'm going to turn it back over to you.
All right. Thank you, Chelsea. Okay, one final suggestion to end with on your visits is remind senators and representatives and staffers that National EMS Week is coming up, May 16th through the 22nd. It's a national celebration of our service and our EMS providers and what they do for our communities. Invite them to come and observe and share in the celebrations or come on a ride along, and make sure that you have a strong social media presence to celebrate EMS Week. It's now with great pleasure that I announce the 2021 EMS Advocate of the Year Award recipients. This year's award is sponsored by Zoll Medical, and it's given out annually to recognize EMS professionals for their efforts to advance the EMS profession through advocacy. This year, we have two very worthy recipients. The first one is Maynard Kopechny from South Dakota. Maynard works at the Kimball Volunteer Fire and Ambulance and is a political representative for both the South Dakota EMS Association and the South Dakota Ambulance Association. An ambulance service director for over 30 years, Maynard has firsthand knowledge of the impact of legislation can have on our EMS profession. He has logged countless hours and miles, making a 3-hour plus round trip from his home to the state capitol. He has built a relationship and educated elected officials through phone calls, in-person conversation, and committee testimony, providing valuable information for draft legislation. Maynard authors a weekly legislative update and encourages his fellow EMS professionals to contact him if they have any questions regarding current or potential legislation impacting EMS. Congratulations, Maynard, for your award. Maynard has also advocated on child abuse, human trafficking, seatbelt requirements, CPR in schools, removing excise tax, and ensuring recognition of EMS practitioners. This year, he distinguished himself by helping South Dakota become the 21st state to pass recognition of the replica legislation and the Interstate Compact.
My name is Maynard Konechny, and I'm honored that NAMT chose me to be an advocacy volunteer this year. I'm sure that there are others out there that are more qualified than I am. I especially want to thank the South Dakota EMS Association for giving me the opportunity to serve in their capacity to represent them in peer, and for sending in my nomination. And I especially want to thank Elizabeth Verhey, who I filled out this application. And once again, thank you, NAMT, for this award. I'm deeply honored. Thank you.
Way to go, Maynard. Our other recipient is Robert Gladsby from Connecticut. Robert is a nationally registered paramedic. He is also the Director of External Affairs and member of the Board of Directors of the Connecticut Association of Paramedics and EMTs, CAPE, an organization he helped to establish. Robert has a strong passion for EMS advocacy and has been working with legislators to bring the concerns of EMS providers throughout the state to the Capitol. He is an advocate for EMS mental health issues and has led the effort for the recognition of post-traumatic stress disorder in EMS personnel by speaking at the state capitol and meeting with legislators on key mental health bills. Robert informs EMS personnel of key legislative issues, their rights, and the ways that they can get involved. He is a certified in mental health first aid and is advancing his knowledge of PTSD. A former coworker said, Connecticut has been behind many states in recognizing that EMS personnel could suffer from PTSD. and Rob has been on the front line from the beginning advocating for EMS. Congratulations to Robert on this award.
My name is Robert Glaspie. I'm a paramedic here in Connecticut. I'm also an advocate for EMS providers throughout the state. I just wanted to take a second to give thanks for this award. It's very humbling. So I just wanted to say thank you to whomever it was responsible for nominating me. I also want to take a second to thank NAEMT for putting this presentation together. I know it was a lot of work, so it definitely is great. It's greatly appreciated. Importantly, I want to take a second to thank a special group of people, and that is the executive board and a few others from CAPE, the Connecticut Association of Paramedics and EMTs. Without this group of people, I don't know that I would have actually been in a position to be nominated or receive this award. So I want to take a second to thank Derek Caranci, Tamara Fisher, Doug Dole, Scott Worcester, Tom Latosic, Ben Zura, Tom Pizzetta, and Nick Paprosky. So thank you guys so much for everything that you guys do. I want to thank them for their efforts and being able to bounce ideas off of them. They really do put in a lot of work, so it's greatly appreciated. I just want to say thank you again. It's very humbling and greatly appreciated. So I just hope that that EMS providers across the nation know that advocacy is something that they can get involved in, and something that can help push EMS forward when it comes to a profession. So it's greatly appreciated. Thank you again. Please be safe.
Congratulations, Maynard and Robert, and thank you for your great service as advocates to our profession. And now we're honored to recognize two outstanding federal legislators as our EMS Legislators of the Year for their leadership as champions of our key legislation. The first one is Senator Catherine Cortez Masto from Nevada. She recognized the challenges faced by ground ambulance providers caring for COVID patients. She was also instrumental in introducing Senate Bill 149, along with Senator Bill Cassidy from Louisiana, to reimburse ground ambulance providers for treatment in place services delivered to Medicare beneficiaries during the COVID public health emergency. She then worked to get this bill included in the American Rescue Plan and the COVID relief package, which was signed into law on March 11th. Thank you, Senator Cortez Masto, for your tremendous leadership.
Hi, everyone. I'm U.S. Senator Catherine Cortez Masto. Thank you all for being here this week to advocate for EMS professionals across the country. Emergency medical technicians, first responders, and paramedics have worked tirelessly to save lives during this pandemic, putting themselves in harm's way to keep our communities safe. Our first responders are on the front lines during one of the most challenging times in our nation's history, and we all owe them a debt of gratitude. EMS professionals have been vital to our nation's response to the pandemic, and they deserve to be treated with respect. And when I saw that ambulance operators weren't being paid unless they took patients to the hospital during the coronavirus pandemic, I knew that was wrong and worked across the aisle to fix it. I am honored to receive the nomination from the National Association of Emergency Medical Technicians as Legislator of the Year. And I look forward to continuing to work with my colleagues to provide our emergency medical workers with funding and resources that they need. Thank you.
Our second representative is Cynthia Axney from Iowa, who introduced House Bill 1609, a companion bill to the Senate Treat in Place bill. Along with Representative John Larson from Connecticut and Representative Bruce Westerman from Arkansas, she has also taken the lead on the 2022 siren appropriation in the House to advocate for increased funding for this rural EMS grant program. Thank you, Representative Axney, for serving as our EMS champion in the House.
While I'm so humbled to receive this nomination for Legislator of the Year, the real praise belongs to our first responders. Our frontline heroes have always answered the call when our communities were in need, and this past year that meant responding to a pandemic on top of every medical emergency imaginable. Every call, every request for help put our first responders at risk for this virus, and they responded. Our communities are deeply grateful for the work of all our EMS first responders. You have been essential to combating this pandemic while maintaining essential healthcare services in times of emergencies. I know I speak for our entire state of Iowa and millions of others when I say thank you for your work and dedication. For me, supporting legislation and increasing funding that helps our first responders is just common sense.
So having started my career in Iowa and spent most of my career in the state of Nevada, I'm absolutely moved and pleased to see that these two representatives from those states are advocating for EMS on our behalf. So again, thank you, Senator Cortez Masto, and thank you, Representative Axney. So before we close the briefing, I want to remind all the attendees to please attend your state delegation meeting. Each of you should have received a calendar invitation with a Zoom link to your state's meeting. And if you need us to resend it, please contact EMS on the Hill at wswdc.com. We wish everybody a very successful meeting with your congressional leaders and their staff. Good luck to everyone. federal legislators as our EMS Legislators of the Year for their leadership as champions of our key legislation. The first one is Senator Catherine Cortez Masto from Nevada. She recognized the challenges faced by ground ambulance providers caring for COVID patients. She was also instrumental in introducing Senate Bill 149, along with Senator Bill Cassidy from Louisiana, to reimburse ground ambulance providers for treatment in place services delivered to Medicare beneficiaries during the COVID public health emergency. She then worked to get this bill included in the American Rescue Plan and the COVID relief package, which was signed into law on March 11th. Thank you, Senator Cortez Masto, for your tremendous leadership.
Hi, everyone. I'm U.S. Senator Catherine Cortez Masto. Thank you all for being here this week to advocate for EMS professionals across the country. Emergency medical technicians, first responders, and paramedics have worked tirelessly to save lives during this pandemic, putting themselves in harm's way to keep our communities safe. Our first responders are on the front lines during one of the most challenging times in our nation's history, and we all owe them a debt of gratitude. EMS professionals have been vital to our nation's response to the pandemic, and they deserve to be treated with respect. And when I saw that ambulance operators weren't being paid unless they took patients to the hospital during the coronavirus pandemic, I knew that was wrong and worked across the aisle to fix it. I am honored to receive the nomination from the National Association of Emergency Medical Technicians as Legislator of the Year. And I look forward to continuing to work with my colleagues to provide our emergency medical workers with funding and resources that they need. Thank you.
Our second representative is Cynthia Axney from Iowa, who introduced House Bill 1609, a companion bill to the Senate Treat in Place bill. Along with Representative John Larson from Connecticut and Representative Bruce Westerman from Arkansas, she has also taken the lead on the 2022 siren appropriation in the House to advocate for increased funding for this rural EMS grant program. Thank you, Representative Axney, for serving as our EMS champion in the House.
While I'm so humbled to receive this nomination for Legislator of the Year, the real praise belongs to our first responders. Our frontline heroes have always answered the call when our communities were in need, and this past year that meant responding to a pandemic on top of every medical emergency imaginable. Every call, every request for help put our first responders at risk for this virus, and they responded. Our communities are deeply grateful for the work of all our EMS first responders. You have been essential to combating this pandemic while maintaining essential healthcare services in times of emergencies. I know I speak for our entire state of Iowa and millions of others when I say thank you for your work and dedication. For me, supporting legislation and increasing funding that helps our first responders is just common sense.
So having started my career in Iowa and spent most of my career in the state of Nevada, I'm absolutely moved and pleased to see that these two representatives from those states are advocating for EMS on our behalf. So again, thank you, Senator Cortez Masto, and thank you, Representative Axney. So before we close the briefing, I want to remind all the attendees to please attend your state delegation meeting. Each of you should have received a calendar invitation with a Zoom link to your state's meeting. And if you need us to resend it, please contact EMS on the Hill at wswdc.com. We wish everybody a very successful meeting with your congressional leaders and their staff. Good luck to everyone.